So first of all, we're going to start from the superficial muscle, which is the pec major, which is on the front of the body. If my client tries to relax their arm as much as possible, so I've got the entire weight of my arm, of their arm into my hand, and then from there I'm going to shorten the muscle. From here I'm going to find the tissue in the muscle, sink deep with my fingers, and I'm also sinking towards the origin, which is essentially the sternum and the ribs there. I'm going to essentially mobilize the tissue of the pec major and increase the range of the muscle. Muscle because it connects the humerus, which is the arm, to the lower back. Okay, so if you ever struggle with lower back pain and you have some sort of a shoulder injury connected, it's also worth looking at the latissimus dorsi because it's the only muscle in the upper body that connects the lower back and the spine down here in the pelvis to the upper extremity. Closing the muscle into a contraction, I'm sinking my fingers into the tissue and I'm sinking them away from the points which I'm trying to essentially mobilize, and I'm trying to open up the area from there. The final muscle that we're going to look at in this treatment for the anterior shoulder pain is the infraspinalis muscle, which is located on the back of the scapula. So the infraspinalis is a muscle responsible for external rotation, which is a really important movement that happens all the time. So if I want to locate it, I'm going to first of all find that scapula, which is very easy to find. Sometimes the pain from trigger pointing this muscle can be felt on the front of the deltoid, and it can resemble the actual pain that people feel for the initial injury. Okay, so if you have anterior shoulder pain and this muscle mimics the feeling that you get usually, then it's probably connected.